By now you may have heard that the 7 local authorities north and south of the Tyne on Wearside and in County Durham have asked the Secretary of State for Health and Social Care to impose some additional regulations onto the 7 local authority areas in order to try and stop the spread of COVID, or certainly to curtail the increase that we've seen recently. You may be wondering why we asked him to do this rather than waiting for a national decision to change the regulations. And I wanted to explain that a little bit. Since the lifting of lockdown, Newcastle has really done very well. We saw a low level of COVID cases for a good number of weeks, but we then began to see a rise in cases and an increase in the amount of spread of the virus that was happening amongst young people. This week we've begun to see another change, and that is an increase in the number of cases in older people as well. This has driven up our rate into the region where nationally action would be taken quite soon in any case. But rather than wait for that, it seems a good idea that we decide how we want to act collectively in order to make sure that we're consistent across the local area and that we do the best job we possibly can in trying to stop spread of COVID. To that effect, what we've asked for is a number of changes that might be made to the way that businesses operate, to the way that people mix and mingle socially, to the way that we support people in terms of self-isolation, the way that we support businesses who are going to be subject to some of the restrictions that we're asking to be put in place, which will include earlier closing, table service only, and no congregation at bars or outside takeaways late in the evening, as we've been seeing in the city centre recently. Some people might argue that at the moment we're not seeing the pressure on the health service that we saw previously, and that deaths in the city are very well down, and I think that's true. We're now seeing things in a much better state than we were only a few weeks ago. But the truth is that as the virus spreads into older age groups, those vulnerable individuals become more and more at risk. And if we act quickly, we can reduce the amount of time that we have to subject ourselves to these measures, and also the severity of the measures that will have to be taken in order to prevent us from going back to the kind of pandemic spread that we saw only a few months ago. I realise that this is very difficult. People have been through a lot already, and we're trying to tread a line between preventing the virus from spreading and all the damage that that would do, and the penalties of a major lockdown with its limitation on people's earnings, their ability to interact socially, the loneliness that it imposes on people, and all of those problems that impact on their health, well-being, and on the economy and the way that we live. This is a balancing act. We're trying to get it right, and it will take us a while to get the balance right between those different parts of protecting the public and trying to guarantee the maximum freedom that we can to the maximum number of people. Please bear with us. This is the right thing to do, and if we act quickly, we have a greater chance of an effective curtailment of that increase in the virus and a better chance of getting back to normal as soon as possible. Thank you.